Welcome to Indian Anatomist. FMGE, NEET, Next 2024, PG exclusive test series. Today's clinical MCQ question is, after falling down the stairs, a small kid was taken to the hospital for emergency treatment. Before sending the youngster for a CT scan, the attending physician examines the cremasteric reflex the boy possesses. In a typical situation, which one of the following nerves would be responsible for carrying efferent impulses to this reflex? And the given options are: A. Femoral nerve, B. Genitofemoral nerve, C. Ilioinguinal nerve, D. Iliohypogastric nerve. In this case scenario, the identifying clues are: 1. Cremasteric reflex, 2. Efferent impulses. In the given question, one of the superficial reflex is mentioned, that is cremasteric reflex. Before talking about the cremasteric reflex, one should know about the cremaster muscle, nerve supply and its action. What is cremaster muscle? According to Greek terminology, it is a hanging or suspender muscle. In males, the spermatic cord and testis, surrounded by cremasteric fascia, that contains a series of muscle fiber loops, made up of voluntary muscle. The cremaster muscle arises from two different sources, but its function is single. Lateral portion of this muscle mainly arises from internal oblique and transversus abdominis muscles, whereas its medial portion comes from pubic tubercle and pubic crest. The genital branch of the genitofemoral nerve, from L1 and L2 spinal segments, supplies the cremaster muscle. During stimulation of the genitofemoral nerve, the testis is retracted, or raised ipsilaterally, during cremaster muscle contraction, and this is called as cremasteric reflex. Since the cremaster is triggered by cold, it is a defensive reaction, and it is possible that it plays a function in testicular thermoregulation. The clinical testing of this muscle is called the cremasteric reflex. The animation depicts the origin of the cremaster muscle fibers, which surround the spermatic cord and testis, from the internal oblique abdominis. When you strike an area of skin that is innervated by the genitofemoral nerve, immediately the cremaster muscle contracts. As a result, the testicles are brought to the level of inguinal canal superficial ring. Now, the fascinating inquiry is, what happened to cremaster muscle in females? In females, the cremaster muscle is more involved over the round ligament, which is responsible for providing support to the uterus. This muscle is smaller than its male counterpart. I trust that my explanation of the distribution, nerve supply, and functioning of the cremaster muscle was clear to you all. The cremasteric reflex is the next component of this subject that has to be addressed. What is cremasteric reflex? It is one of the surface, or superficial reflexes, can be triggered by stroking the skin on the upper medial side of the thigh, regardless of the direction of stroke. Cremasteric reflex occurs when the cremaster muscle contracts in human males, causing the corresponding testicle and spermatic cord to be drawn up to the superficial inguinal ring within the scrotal sac. This is an animation that should not require any explanation. It shows the testis and the spermatic cord being dragged into the superficial inguinal ring of the inguinal canal. This is as a result of the pull exerted by the cremaster muscle. This action happens regularly in male subjects without their conscious awareness, and as a result, it prevents inguinal hernia in males. This mechanism is called the ball valve mechanism. Either upper motor neuron or lower motor neuron lesions abolish the cremasteric reflex. This reflex may be stronger in children and absent in elderly males. The cremasteric reflex may be weakened by scrotal pain, testicular torsion, or recent abdominal surgery. Genital, the motor part, and femoral, the sensory part, are components of the genitofemoral nerve that control this reflex. However, The afferent arc of the reflex may be controlled by sense fibers in the ilioinguinal nerve, whose root value is L1. Have females been found to possess this cremasteric reflex? If yes, then what occurred when this reflex was taking place? A female counterpart of the cremasteric reflex is the Geigel reflex. In the female, it involves the contraction of cremasteric muscle fibers along the upper part of the poipart or inguinal ligament, and is sometimes called the inguinal reflex. Now the major doubt is, why testis is elevated while eliciting the skin of upper thigh? The genitofemoral nerve, which originates in the lumbar spinal cord between the L1 and L2 spinal nerves, is the anatomical basis for this. The genitofemoral nerves have to carry two impulses at the same time, and are 1. Genital branch, the motor component, and 2. Femoral branch, the sensory component. The motor part supplies the cremaster muscle, and sensory part supplies skin of upper thigh in both sexes, and anterior part of scrotal skin in males, or skin of mons pubis and labia majora in females. So, elucidating the upper thigh skin contracts the cremaster muscle, due to their shared root values, L1 and L2. High aspirants, after a lengthy discussion, which multiple choice answer best answers this MCQ? Yes, you're genius. The option B, the genitofemoral nerve, makes the most sense based on the clues, which are the cremasteric reflex and efferent impulses. Hope this helps with your questions about the cremaster muscle, the cremasteric reflex, factors that avoid inguinal hernias, and the genitofemoral nerve. Thank you very much for watching. Don't forget to like, comment, share and subscribe to my channel.